Good sunny evening, mga ka-FHS. My name is Sally Ria Malayan, founder and president of the Filipino Helping Society in Norway. Today, we will discuss about the latest updates from the press conference of the Norwegian government regarding the corona situation and corona measures here in Norway. And together with me are the volunteers of Team Helse Oveldediet of our organization. All right. So, the government is implementing stricter national measures in order to prevent the spread of infection to the areas with low infection rates. The government, following the recommendations of the Norwegian Directorate of Health and the Norwegian Institute of Public Health, is implementing stricter national measures. These measures are in effect from 12:01 in the midnight Thursday, March 25, and will remain in force until further notice. A new assessment will be made before April 12. Okay. According to Bent Höie, Minister of Health and Care Services, the infection situation has become more unstable. We are observing breakouts in an increasing number of locations across the country. Hospitals have had to cancel planned treatment in order to make place for COVID-19 patients, and the capacity of local agencies for infection control and prevention is strained in many municipalities. The number of breakouts across the entire country has been steadily growing, and we lack a complete overview of the situation. Again, that is the statement of Bent Höie, the Minister of Health and Care Services. The Easter holidays are likely to increase the risk of infection spreading because many people may travel more than they usually do and meet more people than usual. The new national measures apply to the entire country. In areas with low infection rates, this will be viewed as a tightening of the rules. In places with high infection rates, such as in Oslo, Viken, Salten, and Haugalandet, very strict measures are already in force, again according to Höie. Currently, we observe the more contagious strains of the virus appearing in places that have hardly experienced a single case of infection. We see that a single case may quickly develop into larger outbreak and that the more contagious strains of the virus cause more serious illness and are harder to contain. This is the experience of the municipalities that for quite some time have been implementing strict measures in their attempts to eradicate the infection. We must avoid the same situation developing in larger areas of the country after the Easter holidays. At this point, it is therefore necessary to implement even stricter measures at a national level, emphasizes Höie. All right. And 500 million Norwegian kroners to be given to affected businesses. We know that these measures will once again affect jobs, particularly in the restaurant and hospitality industry. This is why the government has made a provision in the revised national budget ensuring an increase of 500 million in the current municipal relief scheme for affected businesses. This comes in addition to the 750 million Norwegian kroners currently available within this framework. And now, let us welcome the volunteers of FHS Helseveldedighet for more updates regarding corona measures based on the March 23 press conference of the Norwegian government. Okay, let us welcome Kish, Eloisa, and Kate. Hi, girls. Thank you for
Hi.
thank you for being with us tonight, and I'm really excited to hear from you. And I would also want to formally introduce Kit, Kate, and Yen, who is not with us, are the Quarant Queens, and Eloisa is our team leader and leading the Pandem Chicks. And together, uh, all of us eight will give you COVID info updates all throughout 2021. And now, I'll give the floor to all of you three. Likitil and Gu Poske.
Gupuska.
Go Pasca.
Good evening, everyone. My name is Kish, and authorized Helsipag-Arbeiter and a volunteer of the Filipino Helping Society and or FHS, Team Helsa og Veldidighet. And I am with Eloisa and Kate. Together, we will give you updated information about the topics. But before we start, let us hear from Eloisa and Kate.
Thank you, Tikish. Hi, everyone. My name is Eloisa Febalagat, and I'm an au pair from San Vica and a volunteer of the Filipino Helping Society, or FHS team, Helsa of Veldidehat.
Thanks, Kish and Eloisa. Kate is my name. A student, also volunteer of Filipino Helping Society or FHS team, Helsa of Valdedehet. Together, we're going to report updated COVID-19 from the Public Ministry of Health and Care Services, updated last March 23, 2021. Kish?
Thank you, Eloisa and Kate. Now let us begin. And for the first topic, this is from the Ministry of Health and Care Services, updated March 25, 2021. And the new national measures are the new recommendation as well. The first one is the 1 meter rule is now replaced by the 2 meter rule. In situations where you previously had to maintain a 1 meter distance, before 1 meter distance, ngayon, you must now maintain at least a 2 meter distance. Let's always remember that, of course. And then the second one is they recommend no more than 2 guests in your home. So hindi pwede 3, hindi pwede 4, 2 guests lang. And the third is you have arrived from an area with a high infection rate. You should not go on an overnight visits and not invite overnight guests either. People who live alone, as well as children and young people under the age of 20, may arrange overnight visits with 1 or 2 specific friends. And this, the next is you should limit social contact to the greatest extent possible. So kung pwede 3 meters ganon. And then the next is they recommend to wear face mask in places where it is not possible to keep 2 meter distance. Also, they recommend to visit shopping centers and department stores only in your home municipality. They also recommend to postpone all non-essential travel. Exceptions apply in the following situations. Travel to work when it is not possible to work from home. Students who do not have family members living close to their place of study and who travel home to visit their family. The last one is members of the same household traveling to a cabin together. And it is also new recommendations that it has earlier been determined that effective April 6, all teaching activities at universities, university colleges, and tertiary vocational colleges will be carried out digitally. And the last one is this is applied from March 25 already. And new national regulations based on the COVID-19 regulations. The first one is serving alcohol is prohibited across the entire country. Organized indoor sporting and recreational activities for adults are prohibited, with the exception of professional elite athletes. Fitness centers may only be opened for the residents of the municipality where they are located. Exemptions apply to residents from other municipalities in need of physical rehabilitation, like our PWDs. So, individual exercise regimens and treatments. So, kailangan nila yun. And then after that is the swimming pool shall be closed, but may remain open for children's swimming practice and for persons in need of rehabilitation, as well in a swimming pool. Next is amusement parks. Bingo halls and similar entertainment facilities will be closed. Employees shall ensure that their employees work from home insofar is practically feasible. Kung pwede Work from home lang talaga muna. And after that, person returning to Norway after non-essential foreign travels may stay at quarantine hotels for the entire duration of the quarantine. This will be enforced from it's enforced already from 12 Monday. Today is March 29. So today, we recommend canceling all planned events. In case of events that cannot be postponed, the following rules apply. Indoors events may be attended by up to 20 persons seated in fixed designated seats. Indoor sporting events may be attended by up to 50 participants under the age of 20, beginning to sports clubs in the same municipality. And outdoor events may only be attended by up to 50 persons. And the last is funerals and burial services may be attended by up to 50 persons seated in fixed designated seats. So those are the new updates, I think as of today. So March 29, measures and regulations. Now from the next is, let's hear from Eloisa. Eloisa, what's up with the news for you?
Hi, well said, Ate Kish. Thank you so much. So it is really important to be updated. So the next report will be the strict regional and local measures still apply. So the government has implemented the strictest level of measures, which is in 70 municipalities. In areas where extremely strict measures have been enforced, both on the local and regional level, these strict measures will still apply. Hoya says, for social contact, maintain 2-meter distance from others, with the exception of the people you live with, or in case of people who live alone, their close contacts. Also, wear a face mask when it is not possible to maintain a distance. If there is like a big crowd, you have to wear your face mask. We recommend a maximum of 2 guests in your own home. It is advisable to maintain social contact with the same people in a given period of time. All events that are not strictly necessary should be postponed. We should limit social contact to the greatest extent possible. Next will be the shopping. We recommend to only visit shopping centers and department stores in your home municipality. Next will be travels. The government advises against all travel abroad, Avoid non-essential domestic travel within Norway. We may travel to a cabin or a hotel in Norway, but avoid public transportation if at all possible. If you travel to a municipality with fewer restrictions in place, the general rule is to follow the recommendations that apply in your home municipality. And always remember the general infection control advice, which is the stay at home when you're sick, wear your face mask, have a good hand hygiene, and keep 2-meter distance. Also for work, everyone who can work from home must do so. Employers shall ensure that their employee work from home wherever this is practically feasible. Next will be the sporting and recreational activities. Children and young people under the age of 20 may attend training sessions and recreational activities as usual, if required by nature of the activity. They are exempt from the recommendation to maintain a 1-meter distance. Children and young people under the age of 20 may take part in sporting events, gathering participants from the same municipality. Such indoor events may be attended by up to 50 persons. The limit for outdoor activities is 50 persons, including the athletes, coaches, referees, and if applicable, the spectators. If children and young people take part in joint training sessions with a sports club from another municipality, they will be allowed to compete with members of this club, provided this is possible given the current infection rates. So next is children and young people under 20 years of age who practice sports not involving close contact, such as skiing, may participate in outdoor sporting events gathering participants from the same sports division or region where region is understood as a geographical term. Adults may take part in organized training sessions outdoors if it is possible to maintain sufficient distance from others. So, keeping 2-meter distance. Professional elite athletes may continue their usual training sessions, both indoors and outdoors. Professional elite sports events are allowed, with the exception of league matches, which it is still recommended to postpone. This also applies to practice matches played against other team outside one's own sports club. This also applies to sports in the off season, such as football or soccer, and reducing mobility and social contact is still recommended. So that's it for the strict regional and local regulations. And let's hear for Kate.
Thank you, Eloisa. That was spoken well. Still under the strict regional and local measure includes higher education. So premises at universities, colleges, and vocational colleges are kept closed to pupils and students so that teaching takes place digitally. Libraries and reading rooms can stay open. The institutions can make exceptions from closure if access to the premises is crucial for students who are dependent on experiments or skills training that cannot be carried out digitally. And this is necessary to maintain the progress in the study. So in addition to that, there are also rules for the whole country, and this incorporates sports and leisure activities, prohibition of indoor organized sports and leisure activities for adults, with the exception of professional top athletes. Fitness centers can be open to those who live in the municipality. The fitness centers can also be open to those who live in other municipalities if they are to use the following offers. First, rehabilitation and training offered individually or in small groups with an organizer. Individual training and treatment for which an appointment can be booked. Second to mention, swimming pools, water parks, spa facilities, hotel pools, and the like must be closed, but can keep the following offers open. School swimming, organized swimming courses, and organized swimming training for people under the age of 20, and swimming for top professional athletes. Rehabilitation and training offered individually or in small groups with an organizer. Other individual treatment for which an appointment can be booked and where the bathroom is part of the treatment. Closure of entertainment facilities such as amusement parks, bingo halls, and alike. Second, for the national measures includes travel. So persons who have been on unnecessary trips abroad must stay in quarantine hotels throughout the quarantine period. This is valid from midnight until March 29. Private gatherings and events. Inside, there must be 20 people with fixed assigned seats, down from 100. Also inside, 50 people at funerals and funerals with fixed assigned seats, down from 100. Inside, 50 people at sporting events for people under 20 years who belong to sports clubs in the same municipality. Outside, 50 people at events, down from 200 or 600 at fixed allocated seats. In nightlife, restaurants, and events with a license to serve alcohol, it must be important to take note that prohibition on drinking alcohol is strictly prohibited. In addition to this, there are recommendations from the government this coming Easter holidays, since Easter holiday is now approaching. So this information is updated as well, March 23, 2021. So here are the government's recommendations for how the Easter holiday can be carried out in an infection-prudently responsible manner. So there are two types, generally and socially. In general, stay home if you are not healthy, and test yourself as soon as possible if you think you are infected with COVID-19. Socially, keep 2 meters away from others, both indoors and outdoors. You should limit social contacts as much as possible. You should also take note to avoid visiting more than 2 people in your own home. If your home municipality recommends avoiding visits, you should follow this advice, whether you are at home, in a cabin, or elsewhere. If you come from an area with a high level of infection and strict local measures, overnight visits during Easter are not recommended. Children and young people under the age of 20 and living alone can still have overnight visits by 1 to 2 regular friends. Preferably choose outdoor activities. Avoid going to places where many people are gathered and where it is not easy to keep your distance. Travel abroad is not recommended unless strictly necessary. Avoid unnecessary travel in Norway. Travel to own/borrowed/rented leisure property can still be carried out if you are particularly careful with infection control along the way and at the resort. Then travel with your household, preferably do the shopping before departure and keep your distance from others. Still under travel, use face masks in stores. Only one in the family trades. Trade at times when not everyone else is trading. Next, to mention that it is important to investigate which measures apply in the municipality you are staying in. For example, via the municipality's websites or helsenorge.no. You must visit that website. If you travel to a municipality with less stringent measure than your home municipality, you should, as a general rule, follow the recommendations that apply at home. If you are in quarantine or waiting for test results, you should not go on Easter holidays, not even to your own cabin. If you are at the cabin and get sick, you should go home. If you are cold and quarantined, you should go home. You can travel to hotels within the country, but keep your distance from other guests and limit your stay in the common areas. If you come from an area with a high level of infection and strict local measures, you should not travel to hotels or similar accommodation where many gather. It is not recommended to go from cabin to cabin, as this entails a significantly increased risk of the spread of infection. Take note that if unattended tourist cabins are to be used, it should be possible to book in advance so that no more households or travel companions are there at the same time. If tourist cabins are difficult to access and the need for healthcare and the possibility of quarantine or testing can lead to challenges for local health authorities, it should be considered locally whether such cabins should be recommended for closures. In the case of strictly necessary trips abroad, for example, children who are going to visit parents in another country, it is very important to be careful on the trip and to comply with the quarantine regulations and requirements for testing when returning. Tourism actors should consider limiting access to common areas in order to reduce the risk of infection and make it easier to comply with the infection control and recommendations. Still under the national measure, worship services and other celebrations. At services and other religious celebrations and philosophical gatherings at Easters, rules, guidelines, and recommendations for events apply. You should not attend such gatherings outside your own municipality. It is recommended to postpone all events that it is not absolutely necessary to hold after 12th of April. So that's for now for the national measures. I hope that cleared everyone for the information that we gathered from the Ministry of Public Health and the Care Services. So what's up for Kish and Eliza? Do you
Yeah.
want to say something about those rules and regulation?
Those information are definitely a must know. Thank you, Kate. Yeah, it is really crucial for each one of us to follow the new rules amidst the threat of this corona and mutated virus. And these measures might change. So
Yes.
definitely, yeah, you have to watch the news and conferences of the Norwegian government.
And
Absolutely, yes. These are some of the reminders from the Philippines Samfund in Norge. This is part of the integration and voluntary activities of our organization, and the work is primarily aimed at Filipinos and other minority groups living in Norway and Filipinos in the Philippines. So it is good for an update information.
yes, it's very important to know that. And some of the information must be, changed from time to time. So all of our viewers must keep updated to that.
Yeah.
Maybe there will be some stricter measures
Yes.
or rules
Mm,
that
Mm.
the government can be, you know, release for the people who live here in Norway.
yeah.
So yes, and visit our FB page at fhs.org.no and our website www.fhsnorge.org for more updates and other information drive.
Yes, visit that page, and yes, this has been Kish, and I hope that everyone will stay safe and follow the new rules and amidst the threat of this mutated coronavirus again.
I totally agree with that, Atikesh. Let us all unite in fighting against coronavirus and the new variants by adhering to the measures. Again, this has been Eloisa.
Yes, and I totally agree with that, Eliza. And we must do it for Oslo. You're the for Oslo. And my
Yes,
name is Kate. Thanking everyone for watching our report here in FHS COVID Infodrive 2021.
yes, and then for the next corona report, you just have to watch our other teammates, the Pandam Chicks. They will provide new information about other essential corona topics.
Indeed, but for now, let us end this
Like
report by
Eloisa.
reminding, yeah, thank you, by
Pandam
reminding everyone for the general infection control advice. Always remember, stay at home when you're sick, wear your face mask, do hand hygiene, and keep 2 meter distance. And keep the faith and follow the preventive measures.
Yes, and all we want to say is stay calm, healthy, and corona free. Hada!
Yeah.
Ada!
Ada, go
Go
Posca!
Paska!
Namaste,
Same!
alasamen.
Go Paska! Hi, Lois and Kate!
Hi!
Ada!
Namaste,
Ada!
Hada!